every 2 seconds there's a new diagnosis of breast cancer in our country. So it's something that we deal with quite frequently. The good news is that with the advancements in imaging, about 62% of those diagnoses are caught when the cancer is localized, which carries a 5-year survival rate of about 99%. So I would recommend, as far as screening, for our female patients to do a once monthly self-exam, checking for lumps. And then depending on what guidelines you follow, the obstetrician guidelines, which are the ACOG guidelines, they're a little bit more aggressive with screening. They say females starting at age 40 should start getting mammograms, and then every 1 to 2 years thereafter. The guidelines that we tend to follow as family physicians, it's the United States Preventative Task Force, and they say starting at age 50 and then every 1 to 2 years. Bottom line is, I think it's up to you as the patient, but it's a conversation that I typically have with my patients starting around age 40 for our average risk patients. For those that have a family history of breast cancer, there is, for some types of breast cancer, genetic predisposition, and so in some cases we even start monitoring earlier than that based off of your family history. So talk with your physician, make sure you're doing self-breast checks once monthly, and then the screening mammograms every 1 to 2 years, starting at age 40 or 50, depending on what guidelines and what your comfort level is with that. Again, certainly it's something that we're always aware of, and almost everybody knows someone who's affected by breast cancer. The only other thing I wanted to plug in today was get your flu shots. It's flu season. Technically for us in the United States, October through March, April is flu season. It's too early. I just looked this morning actually to see if we had any data on, is the flu shot this year more effective, less effective. It's too early in the season, so we don't have that data quite yet. As the season starts to unfold, we'll be able to see how well the flu shot is this year. But the reality of it is, even if you get the flu, it tends to be much less severe, and complications that arise from flu occur much less often if you've had the flu shot. So regardless, I would say get it. Age 6 months and above should get a flu shot annually. Age 65 and above should get a high-dose flu shot. So they are predicting a bad flu season, and in fact in our office this week we had 3 positive flus, so it's starting to trickle in. So it takes about 2 weeks for your body to build immunity to the flu shot, so now's really the time to get it. The longer you wait, the higher the chances you're going to catch the flu before the shot is effective. You can't get the flu from the flu shot. It's inactivated. There's nothing live in it. It's impossible to get the flu. You can have a little immune response where you get a fever, low-grade fever, some aches, pains, almost flu-like symptoms. That's actually a good thing. That shows your body has responded to the flu shot, and there's a higher chance that you're going to be able to fight off the flu itself if you were to encounter it that season.